All right, friends and family. Because this is a friends and family type thing. Okay, this is my friend here today. We're gonna do a little filler under your eyes. We already talked about it a few days ago. So you just had kind of these dark genetic, you've had these kind of your whole life and starting to bug you. So when I first look at this, I just want to see what's the symmetry of these under eye hollows. This one is a little deeper, but kind of not as wide. So it's like deeper. And this one is wider, but not necessarily as deep. So this is kind of needs more filler, but on a broader scale. This one is just kind of deep. You know, this kind of is where I want to fill. And again, most people, we have to come out here. He in essence doesn't need it, but this one is larger. Not as deep, but certainly these are kind of areas that we think about. So I try to just look and see if I can avoid any vessels when I'm doing this. Mm-hmm. And I already know in the anatomy that there's certain structures that I want to avoid. So the key to this is kind of putting this in different places. So again, that it's not all in one area later on. This is a really tough place to inject just because of the blood vessels there. So this is a little 30 gauge, and then this is a blunt cannula. So I can kind of put a little filler right to kind of help it slide in. And since this is blunt, I can kind of just get it into place there. Now, what I'm doing here is I am putting a layer of filler in a different, I guess, a different depth than the previous filler. And that's huge. So this is how we reduce the Tyndall effect, or that gathering of the filler that we talked about earlier. And I can reach up there and I can even look and see my cannula. But since it's blunt, the chance of bruising is less. It's not zero at all, but it's a lot less. And that's about it. So